Good day everyone, my name is Chris Daniel M. Sumawang from BSN 1B, and for today I will be conducting an assessment for respiration. So the goal of this assessment is to assess the patient's respiration accurately without any injuries, and the patient only experiences minimal discomfort. So for our equipment, we do need to have a watch that has a second hand or a digital readout. Also, we do need to have a pen or a pencil, a paper or a flow sheet, or a computerized record. Also, we do need to have a PPE. I am already wearing it. So let us now proceed to our assessment. First is we need to assess the patient for any factors that would affect respiration, such as exercise, medications, smoking, chronic illness or conditions, neurological injuries, pain, or anxiety. Also, we need to note baseline data or previous respiratory measurements. So, ma'am, have you been exercising? So, have you taken medications? Um, are you smoking? Have you gone to a certain chronic conditions? Have you been in an injury? Are you in pain right now? Are you having an anxiety? Those are the things that we need to ask our patient. Second, that we need to know any signs of respiratory distress, which include um, retraction, nasal flarings, grunting, or orthopnea, which the patient experiences breathing easily in an upright position, or atachypnea, which the patient experiences rapid respirations. So for our implementations, let us assume that we are still in the position of getting the pulse rate of the patient. So for our first step is when our fingers are still in place for the pulse measurement after counting the pulse rate. The next thing that we need to do is we do need to observe the patient's respiration. Second is we do need to note the rising and falling of the patient's chest. And third thing that we need to do is to using our watch that has a second hand or a digital readout, we do need to count the number of respirations of the patient for 30 seconds and multiply that number by 2 and to calculate the respiratory rate per minute. So let us do it. We also need to know if the patient's respiration is abnormal. We do need to count the respiration for 1 full minute. So assuming that we are already done obtaining the information or the data of the respiration of the patient, for our fifth step, we do need to note the depth and the rhythm of respiration. So for our sixth step, is when the measurement is complete, we do need to remove our gloves, if worn. And we need to cover the patient and help him or her to a position of comfort. So for our seventh step is we do need to remove our PPE if used. And the next thing is that we need to do is we need to perform hand hygiene. So for our evaluation, the patient's respirations was assessed accurately without the patient altering his or her respiratory rate, depth, and rhythm of respiration. So for our documentation, we do need to document the respiratory rate, rhythm, and depth on the paper, the flow sheet, or the computerized record. Also, we need to report abnormal findings to the appropriate person. So that's all for the assessment of the respiration of the patient. That would be all. Thank you.